Please like, share, and subscribe. Blood pressure is a measure of the force exerted by circulating blood against the walls of the arteries. It is a crucial indicator of cardiovascular health and can help assess the risk of various medical conditions. Here's a comprehensive overview of blood pressure. Measurement units. Blood pressure is typically measured in millimeters of mercury, mmHg, and is represented as two values: systolic pressure over diastolic pressure, example, 120/80 mmHg. Systolic pressure, the higher number, numerator, in the blood pressure reading represents systolic pressure. It reflects the pressure in the arteries when the heart contracts and pumps blood into the circulation. Diastolic pressure, the lower number, denominator, in the blood pressure reading represents diastolic pressure. It reflects the pressure in the arteries when the heart is at rest between beats. Normal range. A normal blood pressure reading for adults is generally considered to be around 120/80 mmHg. However, optimal blood pressure may vary depending on factors such as age, gender, and individual health conditions. Blood pressure categories. Normal, systolic less than 120 mm of mercury and diastolic less than 80 mm of mercury. Elevated, systolic 120 to 129 mm of mercury and diastolic less than 80 mm of mercury. Hypertension stage 1, systolic 130 to 139 mm of mercury or diastolic 80 to 89 mm of mercury. Hypertension stage 2, systolic greater than or equal to 140 mm of mercury or diastolic greater than or equal to 90 mm of mercury. Hypertensive crisis, systolic greater than 180 mm of mercury and or diastolic greater than 120 mm of mercury. Risk factors for high blood pressure, hypertension. Age. Family history. Obesity. Physical inactivity. High salt intake. Excessive alcohol consumption. Smoking. Stress. Consequences of high blood pressure. Cardiovascular disease, heart attack, stroke, heart failure. Kidney damage. Vision problems. Arterial aneurysms. Cognitive impairment. Managing blood pressure. Lifestyle changes, healthy diet, example, diet, regular exercise, weight management, stress reduction, limited alcohol intake, and smoking cessation. Medications. Doctors may prescribe antihypertensive medications when lifestyle changes aren't sufficient to control blood pressure. Monitoring blood pressure. Regular blood pressure checks are crucial, especially for those with hypertension or risk factors. Home blood pressure monitors are available for self-monitoring. White coat hypertension. Some individuals experience elevated blood pressure only in a medical setting due to anxiety. Ambulatory monitoring may be used to diagnose this condition. Low blood pressure, hypotension. Blood pressure that's too low can lead to dizziness, fainting, and inadequate blood flow to organs. Hypotension can be caused by various factors, including dehydration, certain medications, and underlying health conditions. It's important to note that blood pressure is a dynamic parameter that can fluctuate throughout the day based on factors like physical activity, stress, and time of day. Regular monitoring, healthy lifestyle choices, and medical guidance can help maintain optimal blood pressure and reduce the risk of associated health issues. Always consult a healthcare professional for personalized advice and treatment. Please like, share, and subscribe.